I'm Professor Tina Kohl Jensen from Department of Growth and Reproduction at Rigshospitalet and Department of Environmental Medicine at University of Southern Denmark. I'm going to briefly summarize our findings in the paper entitled Habitual Alcohol Consumption Associated with Reduced Semen Quality and Changes in Reproductive Hormones, a cross-sectional study among 1,221 young Danish men. And what our study suggested was that even modest habitual alcohol consumption of more than 5 units per week was associated with adverse effects on semen quality, although the effect was most pronounced among men who consume more than 25 units per week on a normal week. Alcohol consumption was also associated with changes in reproductive hormones, especially testosterone and SHBG. So, young men should be advised to avoid high habitual alcohol consumption. We included 1,221 young Danish men when they appeared for compulsory medical examination to determine their fitness for military service in Denmark. When they appeared, they delivered a sperm sample, had a blood sample drawn, and responded to a questionnaire which included information about the alcohol consumption daily in the week preceding the semen delivery and blood sample delivery. And we actually asked them what they consumed of different alcoholic beverages every day the week preceding. And in addition, we asked them whether that week represented a normal week and also whether they had had an intake of more than 5 units in one occasion during the past 30 days. Among those 1,221 men, 553 reported that last week was a normal week, so we thought those men, their intake represented what they normally drank. And we studied those in more details. And we found among those 553 men that even modest increase in alcohol in consumption of more than 5 units per week was associated with reduction in sperm concentration, total sperm count, and a percentage of morphologically normal sperms. Although the effect was most pronounced among men who consume more than 25 units in a normal week. Among men who consume more than 40 units in a normal week, a 33% reduction in sperm concentration was found. In addition, habitual alcohol consumption and last week alcohol consumption was associated with higher free serum testosterone level. So, we think that the reason why we found this strong association was that actually these men were asked about the intake last week and they recalled that better, and then we actually extrapolated whether that week represented a normal week. And since we know that sperm take 3 months to mature, the normal consumption is probably a better marker than just the last week consumption. Our study has several strengths, as it was large and included only normal men with no knowledge of their fertility, which would affect their motivation to participate. In addition, the men had no knowledge of their sperm concentration and hormone levels when they responded to the questionnaire. However, there are also some limitations to the study, and they are that the study is cross-sectional, and we did ask about lots of different confounding factors, but we cannot exclude residual confounding by lifestyle and behavioral factors that we did not ask about. We tried to control for many lifestyle factors like diet and other lifestyle like smoking, but that did not affect the findings. In addition, we did ask the men about their last week intake, which might not represent a normal week, but we actually did this subpopulation of men who actually reported that last week intake represented a normal week. And we asked about last week intake because we thought the men would be better at recalling their intake last week than just the average intake. So, in conclusion, young men should be advised to avoid habitual alcohol intake of especially more than 25 units per week.